Ask 100 people over 60 what supplements they take, and you will get 100 completely different answers. One person swears by fish oil, the next relies on calcium, and others take multivitamins or turmeric. After years of working with patients, I have realized that the real issue isn't which pills people choose. The problem is that almost nobody checks what happens when those supplements mix with aging kidneys, thinning blood, or prescription medications. When it comes to staying healthy as we get older, the goal isn't to take more pills. The true goal is making sure the ones you do take aren't quietly causing you harm. Many people believe that more supplements mean more protection, but that is the wrong way to look at health after 60. When we are 40, our bodies can easily break down and flush out extra vitamins. But by 65, things change. Our kidneys do not clear waste out of our blood as quickly as they used to, and our livers process ingredients differently. On top of that, most older adults already take prescription drugs. When you mix supplements into this mix, it creates a dangerous situation called polypharmacy, where pills clash with one another. A vitamin that was perfectly safe in your younger years can suddenly build up in your body or cause a bad reaction with your daily medications. To stay safe, we need to change how we think about our medicine cabinets. Instead of blindly adding more bottles to the shelf, we have to look closely at what we actually need. In this chapter, we will look at 5 specific supplements that you should stop taking right now if you are over 60, along with the safe alternatives you should use instead. For many years, we have been told that extra calcium is the best way to keep our bones strong as we age. Because of this, millions of older adults take high-dose calcium pills every single day. It seems like common sense. Bones need calcium, so swallowing a large white pill should solve the problem. However, the body does not always work that way. When you take a massive dose of calcium all at once, your body cannot absorb it all into your bones. Instead, that extra calcium spills into your bloodstream, and that is where the real danger begins. Instead of helping your skeleton, extra calcium can travel through your blood vessels and build up inside your arteries. Doctors call this arterial calcification, which is a fancy way of saying your blood vessels are hardening. When calcium builds up in these tubes, it makes them stiff and narrow, forcing your heart to work much harder to pump blood. This process can increase your risk of heart attacks and strokes. At the same time, your kidneys are left with the hard job of filtering all that extra calcium out of your body. When there is too much calcium sitting in your urinary tract, it can clump together and form painful kidney stones. Major medical studies have shown that this risk is very real. Researchers tracking thousands of older adults found that those who took heavy calcium supplements had a much higher rate of heart problems compared to those who got their calcium from food. The studies revealed that while calcium from a pill can cause harm, the calcium found naturally in a balanced diet does not cause these same dangerous buildups. Certain people are much more vulnerable to these dangers than others. If you already have a history of kidney stones, adding a calcium pill is like pouring fuel on a fire. Older women who are past menopause are also at high risk because they are often pressured to take the highest doses to protect against bone loss. Additionally, anyone who already has high blood pressure or early signs of heart disease needs to be extremely careful. Your blood vessels are already under stress, and adding extra calcium can accelerate the hardening process. Taking care of your bones is important, but loading up on high-dose calcium pills might be doing serious damage to your heart and kidneys. The next dangerous combination involves supplements that affect how your blood clots, specifically high-dose vitamin E and certain herbs like ginkgo or heavy amounts of fish oil. Many people take vitamin E to protect their skin and heart, while others use fish oil for joint pain or ginkgo to help their memory. On their own, these vitamins and herbs might seem completely natural and safe. However, inside your body, they all do something very specific. They slow down the process that makes your blood stick together. In short, they act as natural blood thinners. While thinning your blood might sound helpful if you worry about clots, too much thinning is a major hazard. Your body needs to be able to form clots to stop bleeding when you get a cut or a bruise. When you take high doses of vitamin E, ginkgo, or fish oil, you reduce your body's ability to heal itself. The real danger multiplies when you mix these supplements with common prescription medications. Millions of adults over 60 take daily prescriptions for high blood pressure, or they take medical blood thinners to protect against strokes and heart conditions. When you combine a prescription blood thinner with an herbal supplement that does the exact same thing, you are doubling the effect. It is like pushing down on the gas pedal with both feet. This creates a high risk for serious internal bleeding. A simple bump against a table can turn into a massive, painful bruise that spreads under your skin. Even worse, this combination can cause quiet, invisible bleeding inside your stomach or your intestines. In the most dangerous cases, it can even cause bleeding inside your brain, which can trigger a severe stroke. The trouble is that many people do not realize their daily fish oil pill or memory supplement is fighting against their prescription heart medication. Your liver and kidneys are already working hard to process your daily prescriptions, and adding these blood-thinning supplements forces your system into overdrive. If you are taking any medication for your heart or blood pressure, adding high-dose vitamin E, ginkgo, or fish oil to your routine can quickly turn a helpful health habit into a silent medical emergency. The final two supplements that require extreme caution are excess vitamin D and iron pills. Many older adults take high doses of vitamin D to boost their immune system and strengthen their bones, while others take iron because they assume they need more energy. Because these are basic nutrients that our bodies naturally require, it is easy to fall into the trap of thinking that more must be better. However, both vitamin D and iron have a unique property that makes them dangerous when you take too much. They do not flush out of your body easily. Unlike water-soluble vitamins that wash away in your urine when you have enough, vitamin D is stored in your body fat and iron is stored in your organs. This means that if you take more than your body needs, the extra amounts simply pile up over time. Biologically, the more is better rule completely fails after 60 because our bodies become less efficient at managing these storage levels. When you take high doses of vitamin D without a doctor checking your blood, it can cause your body to absorb far too much calcium from your food. This extra calcium floods your bloodstream, leading to kidney damage, confusion, and heart rhythm problems. Iron behaves in an even more aggressive way when it accumulates. Unless a doctor has run a blood test and explicitly diagnosed you with an iron deficiency, you should not be taking an iron supplement. When you have too much iron in your system, your body has no natural way to get rid of it. The extra iron settles into your liver, your heart, and your pancreas. Over time, this buildup acts like rust inside an engine, causing permanent tissue damage and increasing the risk of liver disease or heart failure. It can also cause severe constipation and stomach pain, which are already common issues for older adults. Taking these supplements without clear medical proof that you need them is like filling a gas tank that is already full. The extra fuel just spills over and creates a dangerous mess. As we age, our internal systems have a much narrower safety margin. Without regular blood tests to monitor your actual levels, blindly swallowing high doses of vitamin D or iron can quickly cross the line from helpful nutrition into quiet, long-term toxicity. Instead of waiting for a serious medical issue to happen, you need to know exactly what red flags to look for when managing your daily routine. The most critical step is watching out for dangerous combinations between your supplements and your prescription medication classes. For example, if you take a daily pill from a class of medications called blood thinners or anticoagulants, you must be highly suspicious of any herbal bottle that promises to reduce inflammation or boost circulation. Combining these two groups is a major red flag because they both stop your blood from clotting. Similarly, if you take medications for blood pressure or heart rhythm, adding supplements that contain high doses of minerals can interfere with how your heart muscles contract, causing your blood pressure to drop too low or your heartbeat to become uneven. Another hidden danger is hiding right inside your multivitamin bottle, specifically those labeled as a senior formula. Many older adults buy these comprehensive vitamins thinking they are a safe, all-in-one shortcut to good health. However, if you read the labels closely, you will see that these formulas often quietly stack massive doses of different nutrients. A senior multivitamin might already contain 100% of your daily needs for vitamin D, vitamin E, or certain minerals. If you take that multivitamin and then swallow an individual vitamin D pill or a separate bone health supplement, you are accidentally doubling or tripling your dose. This unintentional stacking happens all the time because supplement companies use multiple names for ingredients or bundle them into proprietary blends. You might think you are taking 3 completely different pills for 3 different reasons, but on a biological level, you are flooding your system with overlapping ingredients. Because aging kidneys and livers process these substances much slower, this hidden accumulation happens faster than you might think. To protect yourself, You have to treat every single bottle on your shelf as a powerful ingredient. By paying close attention to these red flag combinations and carefully reading the back of every multivitamin label, you can stop accidental overdoses before they have a chance to harm your body. The best way to take control of your health is to use a few smart habits that act as multipliers for your safety and well-being. The first and most powerful habit is scheduling an annual blood panel with your doctor. Instead of guessing which vitamins your body needs based on a commercial or a friend's advice, a simple blood test gives you real, undeniable facts. This test looks at the exact nutrient levels currently floating in your system. It can tell you if you actually have a shortage of vitamin D, iron, or other essential minerals. By checking these numbers once a year, you can target your choices perfectly. If your levels are already normal, you can save your money and avoid the risks of taking unnecessary pills. A blood test also checks how well your kidneys and liver are functioning, which tells you exactly how much work your body can handle. The second habit involves the specific timing and spacing of your supplements throughout the day. Many people make the mistake of swallowing all their morning prescriptions and all their vitamins at the exact same moment with a single glass of water. When you dump everything into your stomach at once, the different ingredients can bind together. This prevents your body from absorbing your important prescription medications, or it can cause severe stomach upset. To keep yourself safe, you should space your supplements out. A good rule of thumb is to take your prescription medications first, and then wait at least 2 hours before taking any supplements. This gap gives your stomach and intestines enough time to fully process and send your life-saving medications into your bloodstream without any interference. Furthermore, you should always check whether a supplement needs to be taken with food or on an empty stomach. Some vitamins need a little bit of healthy fat from a meal to dissolve and work properly, while others can cause nausea if you do not have food in your system. By using these two simple behaviors, getting an annual blood test and spacing out your pills, you can make sure your daily routine protects your health instead of putting it at risk. It is important to remember that the advice we have covered so far is a general guide, not a complete list for every single person. Everyone's body is unique, and this discussion does not cover specific drug interactions or unique medical conditions. For example, if you are living with chronic kidney disease, your body has a much harder time filtering out everyday waste, meaning even basic vitamins can become toxic very quickly. Similarly, if you are already taking heavy-duty prescription blood thinners for a heart condition, your rules for supplements will be much stricter than someone else's. Because these situations are complicated and highly personal, we are saving those specific condition-by-condition breakdowns and drug interactions for future videos. The ultimate takeaway from this whole chapter is simple. You must check your supplements before you start stacking them in your cabinet, not after dangerous symptoms begin to appear. Too many people wait until they experience stomach pain, extreme bruising, or a sudden heart scare before they look closely at their vitamin bottles. By that time, your kidneys, liver, or heart may already be under severe stress. It is much safer and easier to be proactive. Before you open a new bottle of vitamins or herbs, take it to your doctor or pharmacist. Let them look at the label alongside your current list of prescription medications. A quick 5-minute conversation with a professional can help you spot hidden overlaps or bad combinations before a single pill enters your system. Your health after 60 is not about how many different bottles you can fit on your shelf. It is about making smart, careful choices that keep your body balanced and safe. By changing your mindset and checking your supplements first, you can protect your health and ensure that your daily routine is truly doing you good. Taking care of your health as you get older does not have to be a confusing guessing game filled with dozens of different pills. When we look back at everything we have discussed, the most important lesson is simple. Taking fewer supplements that are safely verified always beats taking a massive pile of unchecked vitamins. You do not need a medicine cabinet bursting with bottles to stay strong, energetic, and healthy. In fact, cutting back on unnecessary supplements is often the very best thing you can do to protect your aging kidneys, liver, and heart from quiet harm. True health comes from knowing exactly what your body needs and making sure your daily choices are working together instead of fighting against each other. As you move forward, try to take a slow, careful look at your current routine. Think about the hidden ingredients that might be stacking up in your system, and remember to talk with your doctor about getting a yearly blood test to find out what you truly need. Protecting your body is a journey, and making these small, Smart adjustments today will keep you feeling your best for many years to come. If you found this information helpful and want to learn more about how to safely navigate your health after 60, please consider subscribing to the channel. We will be sharing many more practical tips, including specific breakdowns of different medical conditions and drug interactions, in our upcoming videos. Thank you for spending your time with me today, and please take care of yourself.